Hi, I'm Dr. Steve Grinstead. Welcome back to our Freedom from Suffering Now series of how-to vlogs. Today I want to talk about a topic that's very near and dear to my heart because almost every single person I work with, I start with this. It's about the identification and management of stress in order to relax. So some relaxation response training is really crucial in the very first stage of therapy when I'm working with someone, whether it's chronic pain with coexisting disorders including addiction, relapse prevention, marriage and family therapy, whatever it is, I always start with how to identify and manage stress, which is really important. So when we identify and manage stress, we need to have an understanding of what stress is. And one of the tools I use, I'm going to show you in a minute, is the stress thermometer. And teaching people how to accurately identify what level of stress they're at on this thermometer, and then more importantly, what to do about it once you recognize that you're entering in the problem zone. And then implement some relaxation response management tools and truly relax. So that's what I want to talk about today. You know, stress has a purpose in the body. It's part of our defense mechanism called fight, flight, freeze, the survival mechanism. And there's a purpose for it. But unfortunately, as we go up the stress thermometer, as you'll see in a minute, we start losing touch with our reasoning mind, the frontal lobes, the more evolved part of the brain, and we get more into the primitive brain, the amygdala limbic system. And the good news is this is real easy to intervene upon if you've practiced ahead of time. So here I have a very crude stress thermometer. Not a very good artist, but I love doing things because I'm a visual person and many of the people I work with are too. So on this thermometer, you'll see that there's 4 zones: relaxation, the go zone, which I call functional stress. The stress reaction zone is where the survival brain kicks in. And finally, up here at the top, people collapse. So let's start down at the bottom. You know, when you first wake up in the morning, you're at level 1 stress. You're not asleep, you're not awake, you're starting to wake up. And then at level 2, you're probably on autopilot. You're up doing things, but you're not real focused yet. Now at level 3, we start gaining a little bit of focus, but it's more like what I call vacation mode. This is still very relaxed, no big urgency to do anything. And it's hard to accomplish anything when we're at level 3, except to relax, which sometimes I absolutely want to help people get down into the blue, into the relaxation. Now, when we hit level 4, now we're in the functional stress, or what I call the go zone. At level 4, people start coming online. They get focused and active. And then, as they gain a little momentum, they move into number 5, which is free-flowing without effort. So at level 5, that's the ultimate. That's our goal. That's where we want to be. Now, unfortunately, have you ever had one of those days? You're getting everything done, but it's taking extra push. You probably popped up to a 6, where you need to take extra effort in order to get things done. That is the time to intervene. Don't wait till it gets up to a 7, because once you get up to a 7, biology kicks in along with psychology. So when people hit level 7, this is where they go in and out of focus. They get spacey, space out. And it's not a real good time to get anything done. It's not a good time to have a constructive communication with your partner. It's not a good time to try to get anything really critical done at work. You're a little bit too stressed. And then, for me, when I hit level 8, I get irritated, agitated, driven, and defensive. The defenses start coming online. At this point, when we hit this stress reaction zone, the brain starts pumping out survival chemicals, including cortisol and adrenaline. And we're starting to get amped up. So I'm getting irritated, agitated at level 8. At level 9, This is where people tend to overreact. I call this, for me, when I get there, it's my foot and mouth stage. I'm going to say or do something I know I'm going to regret. And then finally, level 10 is where we can't function at all, we shut down, or with a lot of the population I work with, they use pain meds, alcohol, other drugs in order to cope. So it's a very high relapse risk when people get up to level 10. And the collapse zone is from above 10. Now, people with pre-existing trauma, unresolved trauma history, they're at high risk of going up to, say, level 15, and this is where they dissociate, they lose touch with reality. And by the time they get up to level 20, they can be in a full psychotic state, full-blown psychosis. That's psychological and sometimes physiological collapse. That is the stress thermometer. And again, the best place to catch yourself is at level 6. But what do you do? Well, that's what I want to talk about now. What we do is we need to have a plan in place that we've practiced many times. What I do during my sessions is I get a good feeling of who the person is or who the couple is I'm working with, and then I will practice some different relaxation response skills with them and give them an assignment to practice them 2 to 3 times a day between then and the next session. And the premise here is if we don't practice them and get them rehearsed and get them built into our muscle memory banks, when we get up to that 7 and above on the stress thermometer, we won't know how to do it. But if it's pre-programmed, one key word like relax, chill out, something can make a difference at this point. So 2 of the most important things I teach people is a combination of breathing and progressive muscle relaxation. Breathing, along with visualization or imagery, is usually the best. I want to take them through an imagery exercise, have them breathing in deeply through their nose, out through their mouth, close their eyes, visualize a target, whatever that is, it varies on the person, and then for 5 to 7 minutes, do just that. And from past history of working with people with biofeedback, I have found that just by 5 to 7 minutes, everything changes on the readouts. So I want them to practice that. The next one is the progressive muscle relaxation, along with the breathing. So I have them practice this with me in session. For example, I'll start with clench your fists, clench only your fists. Try just to put the pressure just in your hands, not up your arms or shoulders, but just in your hands. And then as soon as you get it as tight as you can, take a deep breath, hold it as long as you can, and when you exhale fully and quickly, release the fists. And then take 2 or 3 slow, deep breaths. Then the next time you're clenching up all the way to your elbows. And the same thing, as soon as you get it as tight as you can, take that deep breath, hold it as long as you can, release. Then up to the shoulders, same thing. Up to the top of the head, release. Down to your middle chest, release. Down to the belt line, release. Down to your knees, release. And finally, whole body, release. And remember, in between the releasing, there needs to be some slow, deep breaths to get the breathing back to normal. So this is progressive muscle relaxation. It's a good way to lower those stress levels on this stress thermometer. When I do guided imagery with people along with the breathing, I can take them from a 7, 8, 9 all the way down to a 3. And they can learn to do that for themselves. Some people need help. So I have some subliminal self-hypnotic products, either CD or MP3 products that I use. I've been using the same brand since 1988. It's Potentials Unlimited. On our website, on the resources page, there's a tab under resources that says Potentials Unlimited. You can check that out and see some of the common titles I use with my patients over the years. I use them personally too, especially the stress and relaxation, relieve stress and anxiety, sleep. I mean, there's a number of different titles depending on what's going on. Some people find that just sitting down and writing out a gratitude list will bring their stress levels down. For other people, it's going out for exercise, walking, swimming, For me, it's playing with the dog, taking the dog to the river. It's whatever works. Sometimes it's meditation. And sometimes, though, it's moving meditation. If I'm too agitated, I might not be able to sit, but I can do a walking meditation. I can do a Tai Chi energy gathering meditation. There's a lot of different things that we can do to bring our stress levels down. So our goal, again, is to stay in the go zone at 4 and 5 optimal. When we get to 6, that's our indicator that we better put ourselves in timeout and do something to reduce our stress. Because when we hit level 7, the stress reaction zone, chemistry kicks in. Cortisol, adrenaline pumps up. We move from the full frontal lobes more into the amygdala limbic part of the brain and the brainstem. By the time we get up to 10, we're in full-blown survival mode at the intellectual reasoning of a 4 to 5-year-old. But we're operating very fast because we're in survival mode. Really not a good place to be if you're in an argument with your spouse, for example. Not a good idea to be up at 8, 9, or 10. Bad things happen. Things get said and done that are going to be regretted for a long time. Now, here's the other payoff for my patients with chronic pain. If they can lower their stress, they can lower their intensity of pain perception. It's guaranteed. And also, when people have a pain flare-up, that also elevates their physiological stress. So they really need to intervene for 2 reasons. One is so they don't go off and do things they're going to regret, but number 2 is so they can bring their levels of pain down. So today was all about how to identify and manage stress using a stress thermometer. A lot of times I'll have my patients develop their own stress thermometer, or they'll do some click art or something, or I have PowerPoint slides that I'll give them with a really nice looking stress thermometer that they can blow up into a poster. There's different things people can do because we need to take charge of our stress before we overreact. You know, it's not a good thing, and believe me, I'm there. I have a trauma history, and sometimes I'll hit a trauma trigger or a shame trigger and my levels of stress jump up. My brain starts telling my body to produce extra cortisol, extra adrenaline. I'm in fight mode, sometimes not flight mode, but sometimes freeze or hide mode. But my go-to is usually anger. Anger energizes. So I'm in that part of the fight, flight, freeze a lot of the time. So I hope this was helpful today. And I really encourage you to let me know any other how-to topics you would like me to present on. And keep coming back regularly because I will keep changing things up. And if you haven't had a chance, check out our freedomfromsufferingnow.com website. There's a lot of resources on there. So thank you for being here today. I really appreciate it, and I'll see you at the next How To vlog.